KMES English Medium Junior College. Welcome its students for the online lecture of psychology. For the chapter 6, Psychological Disorder. For the topic, Nature of Psychological Disorder and Criteria of Psychological Disorder. Students, in today's lecture, we are going to study Chapter 6, Psychological Disorder. Psychological Disorder. This chapter consists of following topics. 6.1 Introduction to Psychological Disorder, 6.2 Nature of Psychological Disorder, 6.3 Criteria for Psychological Disorder, 6.4 Mental Wellness, 6.5 Mental Disorder, 6.6 Major Psychological Disorder, and 6.7 Identifying and Treating Psychological Disorder. But in today's lecture, we are going to study about the introduction, nature and criteria of psychological disorder. Introduction to Psychological Disorder. Psychological disorder is a condition that involves experience, distress and impairment that affect his or her emotions, behavior, thoughts and level of functioning. The major criteria of abnormality are deviance, personal distress and impaired function. It is very difficult to distinguish normal behavior from abnormal one because illness and absence of illness are not distinct characteristics but are on opposite pole of the continuum sequence given by mental health continuum model. According to this model, illness and absence of illness are two opposite poles of the same continuum sequence, in which two adjacent points are not clearly different from each other. For example, an individual can be on any point at a particular time, and we keep shifting our position on it as our situation improves or deteriorates. For convenience of better understanding, let us see the continuum 4 stages. Stage 1. Here the person is physically and psychologically healthy. He/she is motivated and emotionally stable. It means this individual are positive and are functioning well. They show stable mood. They are calm, peaceful and satisfied with life. They feel motivated and energetic. They are physically as well as psychologically healthy. Coming to the second stage, that is the moderate healthy person. Here the person may get affected by life pressure, feel anxious, lack energy, etc. For example, most students are tense before exam. It is possible to push oneself back toward positive health by adopting a healthy lifestyle. Here, individuals are neutral but reactive. They do feel nervous and worried at times and get affected by the stressor of life. Sometimes they may doubt themselves, which will cause anxiety, and this can affect their performance. They may feel tired soon and may lack energy. They might have experienced this too, say, while facing the examination or at the time of interview. But in this stage, if the individual becomes more realistic and accept the limitations and placed by the environment, then they can manage to reduce stress. At the same time, following a healthy diet and a healthy lifestyle with adequate rest and by engaging in more social activity, it is possible to push themselves back more toward positive, healthy functioning. Coming to stage 3. The person shows signs of psychological damage and may experience negative feelings like sadness, lack of motivation, fear, and may even indulge in addictive behavior. However, this even this stage is not reversible. So, here the individual are at the point of third stage. They show signs of psychological damage at moderate and moderately ill. They experience negative feelings. They may lack motivation. They sometimes feel overall empathy and feel tired even when completely they are even while completing their daily routine. Their relationship may get strained and they may even turn toward drug abuse or alcohol. Though they show clear signs of mental illness, they may still be productive and functioning properly. But we may find difficult to do it. But this point is not reversible. By conscious time to find the realistic cause root of the stress and with the help of emotional support such as individuals can fight with the moderate illness are facing. They can get emotional support either from family or friends. Coming to the fourth stage, the person exhibits extreme distress, impairment in mental, emotional and social functioning. She may need professional treatment. Thus, psychological disorder is also called as mental disorder. These are patterns of behavioral or psychological symptoms that impact multiple areas of life and create distress in the person. Criteria for psychological disorder. An individual keeps shifting from one stage to another, depending on his or her life circumstances. In such situations, it is difficult to find whether a person is suffering from psychological disorder or not. The mental health professionals currently use diagnosis procedure to make such decisions. According to the present DSM-5, there are 5 criteria for psychological disorder. They are 1. Clinical significance syndrome. In psychological disorder, you should, there should be a cluster of symptoms together, that is syndrome. Clinical significance syndrome means when we have some physical symptom or complaint, we know that we are ill. In the same way, in psychological disorder, there should be a certain pattern of important behavioral or psychological syndrome that occur in an individual. There are certain symptoms that occur together in a particular order. These clusters of symptoms are together called as syndrome. Psychologists rely on this syndrome to diagnose the disorder. Second one, distress and impairment. There should be distress, that is psychological pain due to negative feeling and stress, as well as impairment, that is inability to perform appropriate role in personal and social situations. Distress and impairment means there should be a presence of distress or impairment. We have already learned about this distress. Distress is the psychological pain. The pain may arise due to negative feeling like sadness, fear, inadequacy, restlessness, or irritability. It may also be due to stress. Impairment is inability or difficult to perform appropriate duty and role in personal, social and work-related situations. Coming to next is dysfunction. If the symptoms lead to development or psychological dysfunction, it signifies mental disorder. Here, if the symptoms lead to an underlying biological, psychological or developmental dysfunction, then it leads to the diagnosis of mental disorder. That is inability to measure, inability to learn, and inability to concentrate, etc. Coming to the fourth one, responses to stressor. If that are normally accepted responses. Example, sadness, experience at the loss of a loved one or culturally sanctioned person are not considered as signs of mental disorder. In fact, if any response given to stressor or loss are accepted as a response to the situation, it is not considered as a sign of mental disorder. It should not be response that is normally given to common stressor or losses, or it should not be culturally sanctioned response to a particular event. Coming to the fifth one, behavior, which is one deviant but does not produce any disability or distress or dysfunction, does not become a sign of mental disorder. It means any behavior which is just deviant or conflicting with society but not produce dysfunction or distress or disability, then it does not become a sign of mental disorder. Behavior should solely be a result of social or cultural deviance or conflict with society or conflict with political system. For example, in certain society and culture, homosexuality is considered as normal behavior. But according to DSM-4, it is not considered as a sign of disorder. In short, psychological disorder or mental illness is a combination or mental illness is a condition or clinical syndrome which involve change in emotion, thinking and behavior or combination of these such that it leads to distress, dysfunction and impairment.